Now it's a very common term, regenerative medicine, and as you can see from the word itself, regenerative, that means regenerate, and it's basically what they're trying to do is replace organs and tissues that have been damaged because of age or disease or because of trauma or any congenital issues. And compared to what we do now, today we are actually treating the symptoms, you don't treat the disease, right? But this concept of regenerative medicine, using new therapies that can actually help to regenerate your tissues and organs. For example, tissue engineering, cellular therapies, artificial organs, medical devices. These are all the new technologies that are coming up very fast that will help us to prevent disease and also to help to repair, regenerate organs and tissues that are already there. So this, I think, is very exciting. Now, a lot of things that like what we do here is more into cellular therapies, and that's what we are doing in our center. The traditional medical approach is basically looking at treating symptoms. We don't look at the root cause of what causes disease and treat that. So it's just symptom control. So medications will just help to block a pathway. For example, someone got high blood pressure, you give him a blood pressure medication, the pressure will come down, but it doesn't cure the pressure. You take away the medication, the pressure goes up again. So whereas looking at regenerative medicine is looking at the root cause itself, repairing the damage that's going on, and hopefully treating the disease that is causing the problem. So that's definitely different. One is treatment and symptom control, the other one is preventive medicine and giving a full cure to the patient. Yeah, I think right now looking at what's available from cellular therapies like stem cells, exosomes, natural killer cells, to even things like tissue engineering, artificial organs and all that. I think in the future almost any disease can be treated with this sort of regenerative medicine. That means if we're talking of repairing the tissues early stage so that you don't go into a disease state. And I think that's what the plan is for the future. I mean, all sort of therapies that are regenerative will look at the individual as a person, rather than giving a general treatment. So basically looking at what we can do for that person, and this is exactly what we talk of precision medicine. That means the treatment we tailored according to the person or what he needs actually. Right now, all our treatments are general. That means someone can, even 100 people can get the same blood pressure medicine or the same cholesterol medication. Whereas coming with the regenerative medicine will be different. It will be very focused on personalized medicine and what you said, precision medicine. That's the trend, and that's going to be the future. I think we are just at the start of this whole paradigm and the whole trend of regenerative medicine. I think we are still in the early stage. Already you can see the difference at what stem cells can do, what exosomes can do, what things like T cells, NK cells and all these therapies are doing. Of course, things like artificial organs and tissue engineering is another very interesting aspect which will come in later. But like when with cellular therapies, we see a lot of things that can help to prevent disease or even treat disease. And the future is going to be even better because we're going to have personalized or specialized cells. That means in the future we can actually culture kidney cells, liver cells, brain cells, heart cells, and this will be specific. That means if you have a problem, let's say go and see a doctor and you find that your liver is not healthy for whatever reason, we'd actually culture special liver cells that can be given to you that will go and repair the liver. That means you can now have a younger, better or a normal liver again, or same with the kidney or the heart or the lungs or the brain. And I think this is where the future is going to be. People will go and do a profile, do a test and see where is or which organ is weaker or which organ is having a problem, and then take the necessary therapies to treat that or repair the damage before it comes into a problem or a disease. And I think the way things are going, just a simple example, you can actually go and repair the pancreas and make sure that the insulin secretion is getting better, or make the insulin receptors better by just giving specialized cells to them, and you can cure diabetes. So this is, I think, the future trend of giving specialized cells to prevent, repair organ before any damage occurs.